Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 7 additional deaths due to COVID-19, including a female in her 90s from Winnipeg linked to Maples Long-Term Care, a female in her 70s from Winnipeg linked to Holy Family Personal Care Home, a male in his 80s from Southern Health, Santé Sud, linked to Mino Home, a female in her 80s from Winnipeg, a male in his 60s from Winnipeg, a female in her 80s from Winnipeg, and a male in his 70s from Southern Health, Santé Sud. We'd like to extend our condolences to the family and loved ones. Been thinking about how we report these many deaths in our media briefings. Reading out the list to provide some sort of honor certainly doesn't do these people justice, just listing them like this. The list continues to grow and it's very challenging to be reading every day. November 1, we had 75 deaths due to COVID-19, and today we're reporting 236 deaths. Just 23 days, we've had 161 deaths related to COVID-19. It might be easy just to think of these as numbers, but we all know these are Manitobans. These are people who are loved, who are missed right now. And if we think about all of these deaths, consider how many Manitobans are affected by this. How many loved ones, family, friends are missing these people now. So certainly we are sending our condolences out to all those Manitobans. Our current 5-day test positivity rate is 14% provincially, 13.8% in Winnipeg. Today we're announcing 543 new cases, bringing our lab confirmed cases to 14,087. We've had some restrictions in place for quite some time now. There are some early indicators that are positive. We have a fewer number of contacts per case right now, which can certainly be an early indicator that our restrictions are having their intended benefit. Over the weekend, we had announced further changes to the essential retail items, so gift cards and newspapers have been added to the list of essential items. We added some remote communities to the list where non-essential items can be sold. And we'll continue to review this list and make any changes as necessary to ensure Manitobans can access the items that they need. Again, the message right now at this critical point is to stay home. So we all just need to stay home as much as possible, which means leaving for essential reasons. We have these critical restrictions in place for a reason. We're seeing these numbers that we cannot sustain in our healthcare system. We're seeing that strain. We're hearing from frontline healthcare providers on the strain in the healthcare system. And so we need to bring these numbers down. We need to act now to do so. So go out only for essentials. Don't socialize with people outside of your household. Get tested if you have symptoms. Self-isolate if you're symptomatic. In fact, if anyone in your house is symptomatic, we should all be self-isolating pending results. All of these things combined will help us bring down these numbers. Talking about the new restrictions, we had reports of a number of faith-based organizations still holding services over the weekend in person. And so it should be quite clear, these orders are not here to restrict your right to worship. These orders are here to save lives. when we have a test positivity of 14%, we see in some areas up to 40%, we can't have in-person gatherings. It puts Manitobans at risk. So we're asking everyone, follow these restrictions. We really want these in place for the shortest duration as possible, but we can't have in-person gatherings right now, not with the positivity rates we're seeing. We need to reduce these numbers, and large in-person gatherings put people there at risk. They put the community at large at risk. They put our healthcare workers at risk. So we need everyone to follow these restrictions. Employers, again, we've asked employers to continue to find ways to support employees to work from home as much as possible. We want to reduce the amount of time people need to leave their house for, reduce the crowded places. So do try to make that work if possible. We see our healthcare system, it's being pushed right to its capacity right now. And we can't expect the number of cases we're seeing right now and the number of deaths we have to report every day as our norm. We have to do better. And we know exactly what to do. We can all decrease our contacts, and the best way to do that is just to stay home. Leave only for essential reasons. For those essential reasons, send as few people from your house as possible. Stay home when you're sick. Get tested, self-isolate as directed, and we can start seeing these numbers come down. So thanks again, and I'll pass it over to Lanette.
Thank you very much. Good afternoon, everyone. Our hospitals continue to fill with COVID patients, putting an increased amount of strain on our staff and the health system as a whole. There are currently 296 people hospitalized with COVID at this moment, and these increases in hospitalizations are a result of the high case numbers that we've seen ongoing for the past few weeks. As we continue to see these high case numbers, we know that we can expect them to come into hospital and within a certain amount of time. We have seen that these case numbers continue to put additional pressure on our system, and we really do need to do everything we can to get these numbers down. As of midnight tonight, 96 of the 103 ICU beds were in use, so we still have some capacity. More than half of these beds, 52 in total, belong to active COVID cases. 43 of the 79 patients on ventilators this morning were COVID positive. We continue to serve people from all demographics in our hospitals at this moment. And while many people envision the elderly in our hospitals, and they certainly are there, specifically in our ICU, we also do have young children, teenagers, and a number of people in their 20s and 30s. We have COVID patients admitted in the pediatrics unit, in the obstetrics units, and in the mental health units. And I share this information in order to reinforce the reality that we are all susceptible to this virus, and we all need to be diligent and careful during these times. In the meantime, we have postponed 901 non-urgent or elective surgeries in the past 4 weeks as part of our efforts to redeploy staff and free up inpatient beds to manage this surge. I will just say also that the number of canceled surgeries is going to become less and less relevant or accurate because surgeons are no longer booking in the same way that they did 4 weeks ago. So if they're not coming to the hospital, they won't be canceled, but that doesn't mean that patient services are not impacted. They are, but they're not always reflected in the data. I also want to provide an update on the number of healthcare workers who have tested positive for COVID-19. In the past week, there have been 17 healthcare workers who have tested positive for COVID-19. 1,523 healthcare workers were tested. The 17 positive tests include 13 individuals from the Winnipeg Regional Health Authority, 3 from Southern Health, 1 from Prairie Mountain, and none from Northern Regional Health Authority or Interlake Eastern. Broken down by profession, this past week's numbers include 1 physician or resident, 6 nurses, and 7 who fall into the allied health or support worker category. There are 3 who have yet to be identified. Since the start of the pandemic, 552 healthcare workers or first responders of the 30,361 tests performed were positive for COVID-19. Many of those may be, some of those will be from travel. Many are close contacts and possibly from the community or work-related. And we are, along with those positive healthcare worker cases, we are also continuing to see increases in the sick time. Nearly 111,000 hours were lost in sick time in the past 2 weeks, which is up slightly from 2 weeks prior to that. And this number would account for those people within the Winnipeg Regional Health Authority who are either at home sick, possibly with COVID, and also potentially isolating as a close contact. And to put that into perspective, 111,000 hours in a 2-week period equates to more than 6,900 8-hour shifts. So if you can imagine, our schedulers are working very hard right now to meet this challenge of replacing sick staff at the same time as the capacity is growing and the demand is increasing in the hospitals and the personal care homes. So I want to thank everyone who is doing the best work they can possible in a really difficult situation to redeploy staff and to move around to areas they're not familiar with potentially. It's very disruptive, but it is necessary and it's also very much appreciated. We are continuing to explore opportunities to improve our testing capacity, specifically for healthcare workers and first responders. So I've mentioned previously that we have the RotoGene that's been initiated at HSC and expanded to St. B, and we're looking for opportunities to expand that even further among other sites. To help determine COVID status among our staff. And that will allow us to identify within 4 to 6 hours a positive COVID case. Healthcare workers who are symptomatic and first responders can get the results quickly, and if they test negative for COVID, they may be able to go back to work with the proper PPE. And we've also opened up the dedicated testing site for first responders and healthcare workers at the Winnipeg Fire Paramedic Services Training Academy, as well as holding appointment spaces specifically for healthcare workers at the Pembina Highway and St. Mary's Road testing locations. I also want to provide an update on the testing site in Selkirk in the Interlake Eastern region. So starting on Wednesday, the testing site in Selkirk will be moving to a new location at 100 Easton Drive, which is the old Selkirk Hospital. And this move will allow for a more comfortable and safer space for staff and the public. As the old location saw many cars lining up on a very busy street. So the Selkirk site will also start booking appointments for testing once they move into this new space. And appointments can be booked starting tomorrow by going online to is.gd/MB testing or by calling 1-855-268-4318. Personal care homes experiencing outbreak do require additional support staff, and we are encouraging regions and facilities to consider services that are currently being delivered that maybe can be decreased or put on hold in order for staff to be redeployed to support the increasing demands in the personal care home environment. And I just want to acknowledge we have seen tremendous partnerships happening recently in the last week where the Victoria Hospital staff has been going to the St. Norbert Personal Care Home to support them, as well as the Brandon Regional Health Authority has been sending support to Fairview Personal Care Home. So we know it's happening elsewhere, but we just want to acknowledge that we just really appreciate everyone's efforts in meeting these demands. The other thing that we're working on is the Red River College micro-training course for uncertified healthcare assistants. So this is a one-week training program that is designed to provide care homes with needed assistance with resident care resulted in 308 applications from first or second year health sciences students. So these applicants are being screened, and those who are determined to have the necessary skills will be able to work within our personal care homes very soon. And so I just want to thank everyone who has stepped up during this period of incredible need. Your willingness to support some of our most vulnerable citizens in Manitoba is really wonderful, and it's a reminder that we all need to stick together in this time. In the meantime, we've also continued to hire. In the past week alone, we've hired 71 new people into our COVID-19 casual pool, and this includes 6 nurses, 41 healthcare aides, 6 medical lab assistants, 15 screeners, and 3 administrators. And then just on a last note, nursing, we are really excited to hear that Manitoba Health has approved a regulatory change last week that will enable our 3 nursing colleges for licensed practical nurses, and registered psychiatric nurses to waive or modify registration requirements. So this will make it easier to expedite the registration of nurses who are either registered in other provinces or recently retired nurses who want to come back into the system to support this work. So we are very encouraged by that progress, and we are looking forward to those qualified individuals to join us in these efforts. We need as much help as we can right now as we expand these services, and I want to say thank you to all of those who are thinking and going to apply, all of those who have recently applied and started working with us. We appreciate your support. We need your support ongoing, and we will welcome you with open arms in whatever environment you come to. So I think with that, I will open up the line to questions.
Thank you. A reminder to our reporters on the line, you will have 1 preliminary and 1 follow-up question. Up first this afternoon from Global, Marnie.
Good afternoon. Dr. Roussin, given all the restrictions we've had in place for quite some time now, were you expecting expecting to see more of a change by now? I know you did say that the number of contacts per case is coming down, which is a good sign, but is that enough, or were you hoping that we'd be further along at this point?
Yeah, at any level that we put more restrictions on, we were, expecting, within that 10 to 14 days following it to see a decline in cases. That's the intent of them. So at this point, we haven't seen that. Of course, we haven't. That doesn't mean they haven't had an effect, but for the restrictions, we could have been seeing much more numbers possibly. So at this point, you're right, the contacts per case does look to be trending in the right direction, and it's expected that that's going to translate into fewer cases in the next week or 10 days.
Right, thank you for that. And my next question is for Lanette. You mentioned we still have a bit of ICU capacity, and you mentioned some concern about seeing these high numbers eventually reflecting in hospitalizations and ICU. Just how concerning are these numbers to you, and how much longer can our hospitals sustain this going at this rate?
Well, it takes a lot of coordinated effort, but we still have capacity. So every day we want to make sure that we have several beds that are available for new admissions. We also know that people transfer out, so it's a inflow outflow mechanism that's happening. We have talked before that, especially within critical care, we have bought all the equipment, the supplies, we've identified the space, and we're organizing the staffing now. So where we're at now is really just the beginning of where we need to go. So we're going to continue to open up space as we need to. We planned for over 100 extra critical care beds. So remember, our baseline was, we started with 71. We're at 100. We still have more to go, but it'll be gradual. It was never intended that we would open up everything at once. We want to be able to meet the demand, and we want to be able to prepare our staff so that they have the proper orientation and familiarization and learn to work in a very different way than they have previously. So we still have capacity. It's just a challenge. It's just a challenge on many levels, but everybody's committed, and I'm quite inspired by my team and the work that they're doing.
From the Brandon Sun, Michelle.
Good afternoon. I'm wondering if you're aware of faith-based organizations meeting in Brandon or the wider Prairie Mountain Health region.
Well, I've had reports of various faith-based organizations that have met in person over the weekend. So at this point, we have enforcement officers looking into it with the possibility of enforcement, right? At this time, but we're not, signaling out any such places or regions.
Okay, thank you. Also, I'd asked on November 13th how many of the hospitalization numbers were actually in hospital for something else and acquired the infection while in the hospital. I'm hoping you've teased out that information, but with an additional detail. Of the individuals now still hospitalized because of COVID, or is it their original admission that they're listed under? I'm wondering, especially with the widespread positivity test, isn't it inevitable that more and more hospitalizations will occur for other routine issues? The individual is currently positive, but was managing COVID without care and still could. Do you have those sorts of details at this point?
Well, we continue to work on it within the medicine unit. I can tell you in the critical care, what I understand is after a certain amount of time, a COVID patient is no longer active, even though they had COVID. So there are actually, I think, around 10 people who are in the ICU who once had COVID but have passed through that journey. So we're not counting those ones as COVID positive anymore. But in medicine, you're absolutely right. It's a bit challenging. We are working on it. It's challenging to determine because As we see outbreaks happening within the hospitals, what we are seeing is people who are admitted for non-COVID issues. If there's any spread on a unit because of an outbreak, they may become COVID positive. That may not be why they're in the hospital, but they are counted in the hospitalization rates. So we continue to work on that. It is a priority because it helps us really with our planning and decision making. But I haven't seen a final document on what those numbers are, but we will continue to pursue that.
From CJOB, Will.
Good afternoon, everybody. Dr. Roussin, you mentioned close contacts of positive cases are down slightly. I'm just wondering if you can tell us what the average number of contacts was in the past week, and if not, could you at least give us some sort of sense of how much that number has decreased, please?
Yeah, and so it's so again, there's some limitations to the measure because we know that we can't link all of our cases, a significant proportion when we see community-based transmission. But I would say that about 3 weeks ago, 4 weeks ago, we were seeing an average about 7 contacts per case. And we've seen that gradually come down to 4, and then some early indications, and again, it's an average, so it has a huge range, but down to 2 in some cases. So we are seeing that certainly the trend is in the right direction.
Perfect. Okay, thank you for that. Follow-up question. We learned on Friday Hanover School Division moving into the level red tier. But we keep hearing there's not much transmission happening in the schools themselves. So I'm just wondering, can you tell us what does transmission in schools look like? And is a 30 to 40% test positivity rate in the surrounding community, is that any indication that that was happening?
Yeah, so we see a lot of cases in school-age children, very few very little evidence of transmission within the school setting, including in the Hanover area. And so when we start seeing transmission or community-based transmission and test positivity rate as high as that, as 40, then it just really makes any type of gathering really difficult to continue. So that move was not based on the transmission within schools, but just the widespread uncontrolled transmission in a community that gives you a test positivity of 40%. So we don't have evidence that school-based transmission led to that. But when you have a transmission rate that high in the community, it's very difficult to continue to operate any type of gathering like that. So we went to remote learning right there, hopefully for a short term, and we'll just continue to follow that situation.
From the Winnipeg Sun, Scott.
Hi, good morning, or I guess good afternoon to both of you. First question to Dr. Roussin. If the RCMP showed up to a church on the weekend outside Steinbach, obvious gathering going on there, and no fines were handed out, how are people supposed to have any, confidence that enforcement is actually happening when tickets weren't even handed out at an obvious infraction?
So I think that the enforcement is important, especially where we're at right now. We have very restricted orders and at a very critical moment in this pandemic. So we're going to need to ensure enforcement takes place. I don't have the details of exactly what occurred there. So we do have enforcement professionals that are taking on that aspect of it. So we may have more information on exactly what occurred moving forward.
All right, thanks for that. My final question is for Lanette. South border, in North Dakota, because of their situation is so bad, they've had allowing infected healthcare workers to work with COVID patients. Is there contingency plans here in place for that sort of thing here, if it came to that point?
Is the question, Scott, if someone is positive for COVID but asymptomatic, can they work, a healthcare worker?
No, they'd be symptomatic and still working with COVID patients.
Yeah, at this point, that's not part of the conversation. We may allow asymptomatic people who tested positive to work, but it would be full PPE on board. At this point, because symptomatic is infectious, that's a risk we're not ready to take at this time. I think I would leave that to the infection prevention and control and staff health experts if we get to a point where we have to change that, but right now that's not our standard practice.
From CBC Radio Canada, Annalie.
Good afternoon. Could you share with us maybe the positivity rate, if you have it, for the region of the BAS, OCN, Kelsey, please?
Yeah, we don't have a test positivity rate broken down for that level at this point.
Okay, thank you. And since we were talking about the Hanover School Division closure, do you think that there is any more school closure that could happen in the next few days, either in this area regarding the positivity rate or elsewhere in Manitoba?
Well, we're always reviewing these things, and if we felt that in a region or it was required to suspend in-class learning, then we would certainly look at that. There isn't anything immediate that we have on board for that, but we'll continue to monitor.
From CBC Manitoba, Bart.
Hey there, Dr. Roussin. Yesterday, the Premier said, actually recorded on Friday, that Manitoba's caught up on contact tracing. I can tell you with certainty that case investigations today began on positives identified on Thursday. That's a 4-day delay and a 6-day delay to when the tests were done. Why does the Premier and why do you continue to say contact tracing is caught up when it clearly is not caught up?
Yeah, I mean, I think that I've heard this on on a number of occasions. The information that I have is that the cases are being almost all cases are being reached within 24 hours of the notification of the positive to public health. And some proportion of those, just depending on the number of cases that day and the time of day it comes in, are carried over to the next day. So the testing turnaround time, the complete thing, harder to measure. But as far as a backlog on contact tracing, the information I have is that almost all cases are reached within 24 hours of the report being reported to public health.
Okay. Ms. Siragusa, you used the term active cases in ICU today. This begs the question, how many patients are in ICU that had COVID but are no longer infectious? And why don't you include them in the COVID ICU count?
Well, I'm trying to think why we don't include them in the COVID case count, because what we want to identify is who's active and where's that virus susceptible to spread. So if they've had COVID for over 30 days, they're likely not infectious anymore. That doesn't mean they don't need critical care, but it poses a different risk, less of a risk for COVID spread, obviously. So I can tell you that number is around 10, where we have patients who are in ICU who had contracted COVID and over 30 days ago, and it's resolved. So I'm including the active cases in the counts that I report, but also giving you the total number of people who are in critical care.
From the Canadian Press, Steve.
Dr. Roussin, today's number is a record high, and it follows a very low number yesterday compared to recent days. Is there a lag of some sort causing yesterday's numbers to be low and today's numbers to be high, or is it just a variation that we see day to day?
There was just a potential lag in just reporting from the lab on those cases. So some got carried over from Saturday to Sunday. So that was the part of that. So the difference between the case counts is much less dramatic than that.
Okay. And given that we're sort of losing track of where the virus is spreading, we're seeing in the weekly updates, unknown source. It's taking a while to find out where the virus is spreading. Are we still confident that it is not spreading in schools?
Well, I mean, we do contact tracing there, right? And so we isolate cohorts. We follow up on contacts of cases there, and so that's where we would, expect to see higher rates of transmission within the higher risk contacts. And so we're just not seeing that to a large degree. Of course, there is some transmission that goes on in those cohorts, but we're not seeing a lot. So at this point, we can still be confident we're not seeing widespread transmission within schools. But we know that as the community-based transmission increases, as the number of introductions increase into any setting, you're going to increase the risk of transmission there eventually.
From CTV Winnipeg, Jeff.
Hi, Dr. Roussin. I'm wondering if, when the vaccine is available, is the province considering an in-school vaccination, assuming students are in school, kind of hit them all at once? And if so, why? If not, why? What are the pros and cons to doing a mass vaccination in school?
So we are, working within the province and federally at looking for the criteria. When we, receive the first amounts of vaccine, it's very likely it's going to be relatively small quantities. So we're going to have to focus on those most at risk of severe outcomes, as well as those most at risk of acquiring it. So, so at first our targeting campaign is likely not going to involve school-aged children. At some point along the line, we'll be considering all these type of ways of getting as many Manitobans vaccinated as we can. But at first, it's very likely we're going to be with a very short supply, so we'll have to prioritize high-risk groups.
My second question is on Code Red rules, and I'm hoping to sneak in a two-part question here. Why can't acupuncturists work? And other people are also asking us, why is cannabis and alcohol an essential service?
Yeah, and so there's many examples. Like we said, we write these what's essential. We wanted to have Manitobans have access to various healthcare providers, and so we list it as those that are regulatory professions, and then you have some outliers like for the acupuncturist. So we look at these things. Right now we're hoping this is going to be relatively short term. We wanted to find that balance of keeping Manitobans at home while still having access to therapeutic needs that are really essential, that are really critical. And so when you write these lists, you're going to have people on one side and on the other side. And, and so we continually review those type of things. And as far as alcohol and cannabis, we've had them on we had it on the critical list, from spring as well, and you could look into unintended consequences of not allowing access to these type of products. So it's really just finding that balance again.
From City News, Jonas.
Good afternoon, folks. Ms. Siragusa, first question is for you on the staffing. The hours that you mentioned earlier that you guys are losing due to COVID, it seems, I guess, for lack of a better word, remarkable. If you're talking like 6,800 shifts or something, can you just maybe elaborate, I guess, are you guys doing okay? I guess is kind of my question on the staffing. You know, like I know you guys are short, but I guess where are you guys at?
Yeah, well, the problem with the way we collect the stats, the sick time stats, is that we don't actually, we can't identify why they're sick. So it may be a parent who has to stay home with a child. It may be a COVID positive staff. It may be a contact who needs to isolate, and it may be a direct care person, or it might be a support person. So we are doing okay because I think that is, well, I should say it's dispersed among a big number of workers in the healthcare system. But certainly they are working very hard in those high demand areas. So people are, there are people doing double shifts. There are people picking up extra shifts. And thankfully, there are also a lot of people who are casual or part-time picking up more. We're so grateful for people who are professionals who are moving from one area into a high demand area, learning how to work with a new team in a new environment. So when I say we all work together and we're going to have to be together to get through this, that's what it's going to take. And so it's challenging. I won't deny that. And I give credit to the people who are providing that direct patient care and heeding the call and coming to work and doing what they can to support.
Thank you for that. As a follow-up again for you, Ms. Siragusa, with the rise in ICUs, we're getting some concerns from local disability communities over what could happen in the future when it comes to end-of-life decisions and stuff like that. They want to ensure that, you know, a disability won't be, I guess, a factor. I know as hard as it is, can you just elaborate on how these decisions could possibly be made?
Yeah, at this point, our biggest decision is how are we going to redeploy staff to build capacity in critical care. We're not at the point where we are having those discussions, and God willing, we won't ever get there. So our biggest challenges right now are what kind of services do we decrease in order to shift capacity, shift resources to acute care and personal care homes at this point. So cutting surgery, decreasing diagnostics, looking at home care services, those are all really hard decisions that we have to make as a system, and there's going to be more decisions like that. So we don't have to make decisions like the ones the disability people or anyone would be asking. We want to be able to rise to this occasion and provide the service that Manitobans need from us. That's our commitment.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, we're hearing people say that prohibiting in-person worship is violating their charter rights. How are you balancing respecting the right to worship with the new COVID restrictions?
Yeah, I mean, I think that the intent of these orders is really, and we've said, is to save Manitobans' lives. When you have a test positivity rate of what we're seeing really anywhere in the province, we can't have large gatherings safely. So we know how important it is, but the balance, the severity of the issue, and all of these restrictions are directly connected to the seriousness of the issue. And so we feel that we're not here to violate people's rights. We're here to protect Manitobans' lives, and we're going to have these in for the least amount of time and the least restrictive fashion that's required.
Do you have any messages for churches who are considering either not following the orders or finding ways to kind of sort around them and find loopholes when it comes to gatherings?
Yeah, it's the same message I have for all Manitobans, is that these are challenging times, and now we're getting into 9 months of these challenging times. But these orders are here to save Manitobans' lives, to protect the people around you, to protect our larger community, to protect our healthcare workers. And so, doing things that fall out of the spirit of the orders, you are compromising things that are in place to save Manitobans' lives. And so I just ask everyone to strongly consider that. And as we move forward for, really this, hopefully this relatively short period of time, we need everyone on board because otherwise you're really compromising people's health.
From the Winnipeg Free Press, Danielle.
Hi, and good afternoon. Dr. Roussin, my first question is for you, and it's just picking up on this contact tracing status. So today we have 543 new cases. How many of those new cases will be investigated and those contact tracing investigations completed within 24 hours? Can you give us, is the expectation that all 543 of those investigations will be done in the next 24 hours?
Yeah, so the expectation is that the vast majority of them will be contacted within 24 hours and the contact investigation started. It's hard to tell you exactly what proportion because it depends on the complexity, right? So there may be a number of those people now that have these one or two contacts. Then our contact investigation is much quicker. We know investigating certain cases who have numerous contacts or different settings, then it's much more complex. So it really depends. But as we see Manitobans continue to have less and less contacts, our contact investigations become much less complex. So it really depends on what the makeup of these numbers are. So I can't give you a prediction on that.
Okay, thanks. And if you can just confirm that I'm understanding this correctly. So within 24 hours, those cases will be contacted, but that doesn't necessarily mean that contact investigation will be complete. And then I guess a question I have is, we talk about the circuit breaker approach, these critical restrictions being in place for a relatively short period of time. So I'm wondering, what is the exit strategy for leaving this level of the pandemic response system? What action does the province have to take today to make sure that when we can lift restrictions, that we don't slide back significantly?
Yeah, so we're going to need to see the numbers come down. We're going to need to see the strain in the healthcare system come down. And then we're going to need to ramp things up very cautiously so that we know that the numbers that we see can be sustained. It's going to require a lot of engagement and a lot of buy-in from Manitobans because we need to. The more we open up, we know there's the possibility of increasing the amount of contacts we have. Which will thus translate into increasing case numbers. So we'll have to do that cautiously and watch the numbers very closely. But like I said, we're fully intending on being able to loosen these restrictions as soon as we can do so safely.
We have time for just a couple more questions this afternoon. Please proceed.
Dr. Roussin, when are you going to increase testing capacity in the Steinbach area?
That's something that's being worked on as we speak, and so I don't know the exact conclusion of that, but it's being worked on right now.
Dr. Roussin, Jeff Keel here. I'm going to circle back to my vaccination question. Are you considering vaccinating children in schools when it's available for whatever that group?
Well, considering, sure. I mean, we wouldn't take that off the table. That's always been a good venue to be able to vaccinate children. It's going to depend a lot on the logistics. Right now the logistics are challenging with these the early vaccines. They have to be stored at very cold temperatures. And so, but we'll see what comes. But it'll certainly be something that's considered. It's a decent. It's quite a good venue for providing large scale vaccines.
Dr. Roussin, you say that you want employers to get people to work at home. How do you feel about the fact that the Winnipeg Regional Health Authority doesn't let its contact tracers work from home?
Well, I mean, my message is the same. If what you need to get done can be accomplished safely, given your exact, the details of the work that you need to get done, then you should consider it. There's probably lots of places where it's just not feasible to have people work at home, but the message is there. If you can make it feasible, if you can get the work done by being at home, then I would encourage all employers to look at that.
I have a reader's question about the transfer of COVID patients to Brandon Regional Health Center from outside the Prairie Mountain Health Region. Apparently the number listed on the website of patients in hospital in PMH only lists residents of PMH, but not patients brought in from other regions, which apparently doesn't give an accurate picture of what's going on at the Brandon facility. Can you provide clarity on this?
No, but we can check up on that. I'm not sure if that's a barrier in terms of the data collection, like the systems we have, but we can look further into that and get back to you.
Thank you.
I have a
Ms.
question.
Siragusa, is it true that you were working personal shifts in personal care homes?
Thank you. Thank you.
Sorry, what was the question?
Is it true? Can you confirm that you personally are doing shifts in personal care homes?
Yes.
Whereabouts?
Pardon me?
Whereabouts?
At a personal care home that's in an outbreak right now. I went to help out over the weekend.
Leading by example.
Dr. Roussin, Jeff Keel again. I believe it was over the weekend, there was an announcement that there was a 20-year-old who had passed away from COVID. Do you know anything about that case? Were there underlying conditions?
I don't have details. I do believe there's underlying conditions. Again, I think there's a lot of misinformation, out there about the deaths related to COVID. If you look around us, look around our loved ones, and think about how many people that have some sort of underlying condition. And so I think there's some misunderstanding that just because somebody had an underlying condition that COVID didn't have a severe impact on their life. Almost every death is in someone who has an underlying condition. Right, we see the most of deaths are those in older age groups. So just because a person died and had an underlying medical condition, this doesn't minimize the impact of COVID. Think of all the Manitobans that have some sort of underlying condition. They were doing just fine. And just because they have an underlying condition doesn't minimize the effect of COVID. So I'd like to just remind people of that somehow this doesn't, undervalue the importance of these deaths just because somebody had an underlying condition.
Dr. Roussin, Martin from Global here. With the amount of community transmission we're seeing and the rate our case numbers are increasing, how many cases do you think we have in the province if you were to include people who are asymptomatic or people who aren't getting tested? How much of an impact would that have on the numbers that we have?
I think with any communicable disease, there's always more, actual cases than we have confirmed by test, and there's lots of reasons for that. The actual number of that, it's difficult to know, but it's certainly significant amount more cases than we actually detect.
Thanks, everyone. This concludes our media briefing.